So by that understanding the current scenario with the COVID-19 pandemic, so the department I was willing to have a similar topic, particularly regarding the immunization. So thank you very much, Dr. Deshmukh sir, for accepting my request, and Dr. Anjana Singh ma'am, then Dr. Patnakal sir, and our honorable sir from Bangladesh. So for accepting my invitation, it's very short notification, and to have your thoughts and ideas and to share your ideas with us during this webinar. So with this short welcoming, and all the participants from Eastern University Sri Lanka and from other universities from Sri Lanka, as well as particularly the Maharashtra delegates and the participants from Maharashtra, as well as all other Bangladesh, Nepal, and all our participants who have joined and who is going to join very soon with us for another couple of hours. So let me welcome, give you a very warm welcome, and it's my great pleasure. In fact, I am so pleased and privileged to have you all with us today with our university, the Eastern University Sri Lanka. Thank you so much. And now I would like to welcome Deshmukh sir, and I would like to invite Deshmukh sir, the Honorable President of the Organising Society India. For thank you very much, sir, for your all sort of attempts. I mean, to have all these kind of webinars, and I am kindly inviting you to deliver the inaugural address at this moment. Most welcome, sir. Thank you.
Thank you, madam. Today I am very happy because now all we microbiologists from SARC countries are together, well acquainted with each other, well known to each other, and because of this seminar again, we are coming together. So the topic is also very, very important because just today only in Maharashtra, one of the great leader, Honorable Sharad Chandraji Pawar, he told that Corona is still in the public. Don't neglect Corona because the public has started neglecting Corona. And as the public has started neglecting Corona, there is a chance that Corona may spread. And again, it will be a national calamity, international calamity. So, we must be precautious. And that's why today's seminar is also on that line, that still the calamity of Corona has not ended, and we have to think again and again regarding the Corona. So there are 4 lectures today, and it's the beauty of the today's conference is that one speaker is from Nepal, one is from Bangladesh, one is from India, and one is from Sri Lanka. So 4 different speakers from 4 different corners, neighboring countries, are coming together and sharing their views, sharing their thoughts on Corona. I really congratulate Chandrakantha ma'am. And today's total conference will be recorded. It will be uploaded on Microbiology Society YouTube channel. And all attendees will receive the certificate of attendance. So thank you very much. I will not take much time. On behalf of Microbiology Society, I welcome you all, and I wish all the best to Chandrakantha ma'am. Thank you. Thank you.
Thank you very much, sir. Thank you very much for your short and sweet inaugural address. It's my pleasure again to join with the microbiology. Society India, and wonderful opportunity, as you mentioned, to have four speakers from four different countries, the neighboring countries. Is the beauty of this Microbiologists Society India. So, with that note, let me welcome our first speaker and the technical session, Professor Dr. Anjana Singh, the former head Central Department of Microbiology, Tribhuvan University, Tripur, Kathmandu, Nepal. Let me give a brief introduction about the Professor Anjana. First of all, let me play.
Oh, she's
Jawaharlal Nehru, JNU, New Delhi, India. And also, she got her postdoctoral University of Virginia, USA. And she has got main activities in her university and her department, particularly her service in the microbiology. Let me pick up some very important milestones in her career. First of all, her awards and honors. Let me briefly go through that. She, of course, a very privileged scholar, that is the Fulbright scholarship from the United States, and also education award from Nepal International Foundation for Science, Sweden Craft award from Nepal, then Mahindra Vidya Bhushan award, that is again from Nepal, and various other very privileged and very various awards she has obtained from her country. So that shows that her commitment in her career, particularly in microbiology. With that, very particularly the publications she has published, total national and international publications is 124, in which the peer reviewed journals, 59 peer reviewed journals she has published, works, as well as 3 books and 25 chapters in book chapters, as well as the general and preceding publications as 28, abstracts published as 9, and accepted articles, which is on pipeline, so far is 9. And also she has supervised since 1999 till to date, and 103 master students, as well as PhD guidance, 4 complete and another 4 ongoing. So she is a peer reviewer in 6 international reputed journals. Also, she has attended 67 national and international workshops and conferences. And also, the country, so far, she has visited 9 different countries about this, to deliver her research works and to disseminate her research work through the conferences and symposium. So, with that introduction, I'm so pleased, so privileged to welcome you, Professor Dr. Anjana from Nepal. It's your time, Professor Anjana.
um, thank you for a very nice introduction of mine, Dr. Mahindranathan. First of all, I would like to thank for giving me an opportunity as well as invitation for presenting COVID-19 effect on women specifically on this auspicious webinar. That is the first international webinar, Corona Spread and Control, jointly organized by Department of Botany, Faculty of Science, Estern University, Sri Lanka, in collaboration with Microbiologists India. First of all, while going through it, I just wanted to share a few of the national and international information. Like in 1918, Spanish influenza, we also faced, the world has also faced this epidemic at that time, and people started saying God bless you, because within 5 days of sneezing most of the people, they tend to die. So this has been delivered by Professor Gian Battista Parisi from Pavia University, Italy. So I just wanted to share this. And similarly, that Black Plague that was in 1346 to 53, in the 13th century, almost one third of the European population got killed at that pandemic. And herd immunity took place. That has, it took almost 7 years for the herd immunity to develop. So I'm just relating this with COVID, this 19 also. And at that time, we all know that this COVID-19 pandemic, it has spread it from Wuhan, that is one of the place in China. And at that time, what happened is from Wuhan to Europe, when we travel in 1990 from ship, it almost used to take 30 days, right? But now world is changing and it is fast in changing. So 2029, 21, right now, it only takes 12 hours to travel from Wuhan to Europe. So we know that how this it has the danger has also occurred without with this, that infectious diseases can spread within 60-fold more, right? So similarly, 25 years of female, it was found that she has been suffering from atypical skin disease, and it is found that in skin biopsy also in Spain, it was found that COVID-19 was also found. This was published in 10th November 2019. Similarly, another example is Ebola outbreak. It occurred in Western Africa, and almost at this time also, just like this kind COVID-19 pandemic time, the neonates are having they are not having vaccination, and even oncological treatment is delayed. C-sections are being decreased in hospitals, and mostly the general patients, sick patients, they are decreased in the hospitals. It was in Ebola time. Now we are also facing the same problems and same critical situations in COVID-19 time. So a new paradigm specifically in the worldwide academic interactions and knowledge sharing, revitalizing sustainable development, that is the SDGs goal number 17, where global partnership is needed, it's been said. Now, due to the COVID-19 pandemic, this has been increased, and the time has demanded the global partnership. Now, even now, we can see here that almost 4 of the countries we have been involved right now. So I see that there is slowly we are coming to the SDGs number 17 goal. And in Nepal, impact of COVID-19 outbreak has a negative impact as well as positive, similarly in the global effect. When we talk of negative impact, is that it has negative impact in the industries, especially in the hospitality industries. And similarly, projects and imports that have a very high impact. That is, the projects have slowed down owing to the delay in procurement of the materials from overseas, and increasing unemployment is developed, which is also true throughout the world. And besides this, lockdown started in March 24 in 2020 in Nepal, where it restricted movement and activities. So there is disrupted services, there is confined to desk work, especially the teaching, report writing, and virtual meetings have been more pushed forward and forced to do also. And in addition, issues concerning quality of work done, specifically those which need field studies, due to the lack of monitoring, as in some cases the work is still there is some discontinued work also, and some needed more time. And in COVID-19, since it is a health issue having a long term, it has a social impact, economic impact, and all are affected, but we all agree that women are more disproportionately affected. And when we talk of qualitative methods, there are mostly review of available literatures, new articles, mainly focusing on secondary source of informations has been dealt with, and telephonic interviews with women and practitioners are being done, and primary source of information, especially with the help of open-ended questions, and however lab works are being hampered, and of course consolidations from both is observed. When we talk of positive impacts, change in practicing of sharing, specifically household care work burden with men, family members are also being seen. Flexible working hours we can observe, though it is heavy work burden is there, improve bonding with family with more quality time spent at home, and there is time to attend to ignored hobbies like culinary arts, gardening, painting, and so on, and cooking, of course, and learning new skills, optimizing use of technology. Specifically, nowadays we know that online tools and applications, and financial savings is seen, however, because people they don't travel and cost is saved. Homegrown food has been taken more and cooked healthy food. More opportunities are available for scientists to explore and further expand knowledge and skills through online learning. Besides this, we have negative impacts in the society also. Increased care work burden. This is true for all, but however, more on women, because women has to look after their home, their office work, and for their children for homeschooling and looking after the elders and so on. Besides their academic, they also have to do home housework side by side, and disrupted services and restricted mobilities, and restricted activities with physical distancing, affecting social life and so on, affecting mental health, obviously, because staying at home and not meeting people and staying at the same environment all the time, and use of all paid leaves, so financial impact is there. Less work hours resulting to lesser pay, so again there is a financial impact. And for women, as I have told you, that increased burden due to the demand of both work at home and work at workplace is being seen. Due to lockdown, number of online activities for scientists and research students are increased. Webinars, just like now we have been doing also. And obviously, though there is a physical distancing also, there is a positive impact that we've been in touch through the online activities. There is video conferencing, video virtual meetings, online courses, international scientific seminars, etc. are going, and we are attending also. However, these has to be done amidst many distractions and disturbance within home, with some households further burden and poor internet quality, which I face today also with power cut as well as internet poor internet connection. And obviously, in side by side, it's very sad to say domestic violation is also increased. And for specifically for the earlier career positions are affected, like for postgraduate students who had time limited work, coursework or thesis work were affected due to loss of productivity during the movement and restricted period. And the need to extend contracts and funding periods beyond the original agreement dates added more stress to some scientists. Uncertainty in funding the COVID-19 era that may affect the scientific community, which continues to be a concern till date. Missing deadlines, travel schedules, it's all disrupted. Lengthy postponement of scheduled programs like teaching courses and examinations and all. Scientists, however, they are enforced to work from home, and most women had to work through their night to achieve their goals, cutting down their sleeping time to make up for the time lost during the daytime, resulting in sleep deprivation, obviously, and also association with health and safety risks. That is reduction of the quality of work performed, decrease overall productivity. And there are some recommendations I would like to put forward that additional proofs needed, specifically gender disaggregated and intersectional data that may look into the impact of lockdown. And there should be some support of policies for flexible working hours that understand the needs of family care work, and support to increase paid family leave and paid sick leave, or introducing no reduction in pay for reducing working hours, specifically at circumstances like this. Familiarizing subsidiaries and vouchers for the use of telecommunication technology for work, and promote good practice of sharing care work burden that will change the social norm. More gender balanced, obviously. and support to adapt to new contexts by learning new technology and maximizing opportunities like virtual trainings, web-based works, etc. Ensure physical and mental well-being by staying positive and spreading positive messages throughout webinars, media, etc. And encourage and establish work from home culture in the future to strengthen family bonding with the advancement of technology, which has been proven that official duties can be worked from home too. And myself, I've been involved in conducting webinars and seminars and workshops and talks, etc., like this, related to COVID effect. And we have also conducted post effect of COVID-19 on women, organized by Women Scientists Forum Nepal, where I'm the president, under the Nepal Academy of Science and Technology. And there is a Scientist Nepal, a kind of a voluntary forum, which its initiative is to be prepared in an organized way to combat COVID-19 pandemic, and cohort group of scientists united for intellectual discussion under the leadership of Dr. Deshmukh. We have worked under this, and every week we have seminars, and we have produced a book on this, but it is written in national language, Corona ka Saya Sawal, meaning 100 questions that has been come up with Corona-19, that is COVID-19. And we try to answer these questions, and we have produced in a book. And specifically targeting the local people, the layman people, and school-going children. So, and also involved in interviews in radios, TVs, and online media, wrote article and write-up on COVID-19, wrote article on COVID-19 in Vigyan Lekhmala. It's a kind of a journal which has been produced by Nepal Academy of Science and Technology, specifically focusing for school-going children, because this is the time that we need to focus specifically the layman and the school-going children. So it will help directly, indirectly to at least to maintain COVID-19. And we specifically in Nepal, there is few of the researchers are going specifically on field work, and then working with the scientists. And few of the scientists, they have produced sanitizer production with herbal cooperation, production of masks, and COVID-19 vaccine arrived in few days, which is a good friendly effect that has been shown from India. They have gifted the vaccine, and it is basically it will be focused for the this is so the doctors, the nurses, and the paramedics who are the frontline workers, and most probably later the public will get it. We hope for that. And national highlights, I just wanted to give you, according to the WHO, that it recorded that 97.3% has been recovered till now due to COVID-19. And active cases are still there, 1.99%. And home isolations, we have 32.8%. And death is about 1,893 deaths till date. But this is basically in the almost 97% in the hospitals. And comorbidity is that it is due to the hypertension, which occurred 39.2%. And obviously it is, since Kathmandu is the capital, we have higher rate of cases, active cases in Kathmandu, and average 7 deaths per day. And mostly 65% of females are affected, which is almost similar to the global data. And death rate is more in 65 years of age of person. And we now also have 3 new European strains found. So daily new cases in country and in Kathmandu is increasing due to less number of daily tests, which I just talked unofficial to Dr. Mahindranathan, as well as Professor Deshmukh also. So Kathmandu, Nepal, the death rate, it shows that it is decreasing. Maybe it's because that the number of testing is also decreasing. And we have higher positivity rate during the Dashain and Tihar, that is the Deshera, and that is a national festival during the Diwali, where almost 25% increased at that time, maybe because of the mobility of people. And contacting tracing has been a lesson right now. But however, when we go for the statistical data, positivity in Nepal is still very high. It should be less than 5% for pandemic to be under control. And contact tracing is very low, and it should be at least 10 according to WHO. And we know that according to the international economist Noam Chomsky, he has said pandemic control is a failure. So indirectly, it is also very true to Nepal also. And policy making is very essential not only to COVID-19 pandemic but also in future such diseases if coming up. And with this, I would like to say that science is drastically affected. And thank you very much.
Thank you very
Over
much.
to you, Dr.
Yes.
Chandrakantha.
Thank you. Thank you, Professor Anjana. Professor Anjana Singh from Tribhuvan University, Kathmandu, Nepal, and for your wonderful input, particularly giving the insights of the situation of the COVID-19 pandemic in Nepal, particularly in the aspects of women, effect of women, which is rather important these days because, as you said, where the women is with sort of stress, we are working at home as well as working at in the society as well as in the they are working. So all these having these ideas, bringing your wonderful thoughts with us and sharing the wonderful thoughts with us, Professor Anjana Singh. Thank you very much again for joining with us, and stay tuned with us until we finish our another couple of hours program. Thank you so much. It's my privilege to have you with you all here. So let me invite our second speaker, Dr. Vaidehi Rajivan Francis, the MBBS doctor from Teaching Hospital as well as Department of Physiology, Faculty of Healthcare Sciences, Eastern University, Sri Lanka, our university. Let me give a very, very brief introduction about Dr. Vaidehi Rajivan Francis. She is actually a microbiologist and she's from Department of Physiology. Now, what I want to really mention here about Dr. Vaidehi Rajivan Francis actually is in our district during this COVID pandemic. Now, she is a very famous figure. I'm so proud to say that instead of figure, a very famous doctor because not just giving her duty or her service to the society, her concern in our society in controlling, not only controlling or taking any steps in spreading this corona or the COVID-19 coronavirus, but in apart from all these things, she has been handling all these microbiology tests and PCR antigens and everything. She is the one and only in charge from this hospital. So she's not her job, but I have so far heard that about her. She's very young actually, but in apart from with all her duties and everything, but the people have been around the district. What I have heard from her is her kindness, particularly her kindness in delivering, in giving her service to the patients, not only the patients, the public. So this is what we have been so far, I mean, receiving from all sort of publics, not from the universities, not from the public or the private sectors, everywhere. What we hear simply from about her is conducting all sort of antigens and PCRs tests, because the public, these days the public are very much concerned, and they have been some kind of having a unknown threat, fearness about this PCR testing and all. Wherever she is handling these patients, what we have heard from the community, her kindness in conducting these tests and all, and sharing her services. So it's my privilege to welcome you, Dr. Vaidehi Rajivan, and thank you so much. I know you are very scheduled all these days actually, and with all this your hectic schedule, I would say, for accepting my invitation and giving your, I mean, consent to join with us at this time. So thank you very much for your service, what you have been carrying out actually, being such a young microbiologist and a doctor from our teaching hospital. I mean, in addition to the test, the counseling, the support that you are giving to the patients in, I mean, continuing their whatever the hardships under this period. So that is really excellent. So thank you very much. excellent. So we are so much thankful. All the very best to continue your service to the community from this region very successfully, Dr. Vaidehi. So I'm so privileged and pleased to welcome you at this moment. It's over to you, Dr. Vaidehi, Rajiv and Francis. Thank you.
Thank you very much, madam, for the very kind introduction. I'm not that young, as you said. Okay, to start my thing. This is the first time I'm presenting on this because we are very used to Zoom. I'll try my best. If there's any problem, please help me to come out.
Do you want to share the slides, Dr.
Yeah, I'm trying
Vaidehi?
to share it. I'm trying to share. Ah, yes, okay. It's coming up now.
Okay, fine. Okay.
Can you see? Yeah. Okay.
Oh, yeah.
You all can see, no? Yeah. Okay.
Yeah. Yeah. We have got it. We can see that.
So yeah, no, it's I can't see now. Okay. Can you all see now?
Yes, of course.
Okay, right. So I chose this topic because the laboratories also playing a major role in control of COVID. So I would like to start with now in Sri Lanka, I hope everywhere in the world, general public start talking about PCR. That's kind of before COVID, very rarely people speak about PCR, but now everyone is talking about PCR. And people talking about RT-PCR equipment even, how many you have, how many other labs have, those kind of comparing and things. Rapid antigen test that newly introduced, well famous, popular, and some paranoia too. And people talk about false positivity, increased PCR capacity. So these are before COVID. We never imagined these people can, the lay people can talk about these things, but now pandemic has brought these things to the general public. That indicates the importance of the laboratories in the pandemic. So when we move along, so why it happened? Because the WHO started this test every suspected case, and that's the success of control of pandemic. I'm not going to argue with that, but we all are following this. We are all are trying to test them as much as we can. So what actually happened and Sri Lanka, how we reacted to it, because the PCR was very sophisticated, used to be a sophisticated test and had only one or two laboratories. Central part of Sri Lanka was capable of doing PCR for regular clinical services, and there were some university laboratories were doing for research purposes. But with this pandemic in March, government aimed to increase the capacity of increase the PCR capacity. So it increased the number of labs which are capable of performing PCR testing. So it both the government sector and private sector. Under the government sector, both hospital laboratories as well as the university laboratories. So here the hospitals come under Ministry of Health and the universities come under Ministry of Higher Education. So both are different arms, both are government sector, but both are in different arms. But COVID made us together, brought us together. So then both the hospital labs as well as the university labs, the government tried to work out and increase the number of PCR labs. At the moment, I think around 20 or 25 labs are performing PCR in the country. That was that never imagined that much of capacity we can have in the country within shorter periods. Right? So the government purchased necessary equipment so quick. So in I think you all may have experienced in this our part of the region how difficult to purchase an equipment, but everything happened with minimal paperwork, all email communications, and so efficiently the necessary equipment were purchased. And the equipment were mobilized from one part of the country to the other part of the country where the testing capacity needed essential equipment were there. For example, Eastern region, we didn't have RT-PCR equipment. So the Commission chairman arranged it from University of Peradeniya, and we used up to last month that machine for doing PCR, and we did nearly 40,000 tests using that equipment, and then we got a new machine for our hospital. So it's a kind of mobile, and all the equipment we still have been using are borrowed from Estern University and other universities. So kind of mobilized the equipment to increase the capacity in a short period of time. So efficient. We never imagined it's ever possible, but it's proven it worked well. It has been working well. So and the supply chain, the very difficult during the pandemic, and with increasing amounts of testing, the supply chain was coordinated very well, and the reagents and consumables at a higher level. For example, now the current health secretary, the present health secretary used to be the coordinator, the chief of the supply chain in the early part, and he did a fantastic job, and with everything updated on the Google Excel sheet, and all the shortcomings sorted out within few hours. And we are 300 kilometers away from the capital, and with we don't have a express way to come from Colombo to Bati, but it takes 6 to 7 hours with all these lockdown measures, with the support of the Triforces and a close communication between the suppliers and the ministry. We were able to get down the reagents and consumables within half a day throughout the testing period up to now. So that's well coordinated supply chain, so important. So what do we do? The labs do. So we all over the world, they can confirm the cases. That's very, very important. Confirmation of cases. And they identify the strain by sequencing. So not all the labs, but only at the reference labs, Sri Lanka, only 1 or 2 labs can still do that. We just confirm the cases, not sequencing, but still the role of laboratory, yes, they sequence, they identify the mutation. So now even public speak about mutations. That's really, as a microbiologist, surprised to see how the media help promoting the public education. I don't know whether it's good or bad. The people talk a lot about these mutations and things. And the contribution of to the molecular epidemiology, not well heard of, but we know how important it is, and how the laboratories contribute to the understanding of molecular epidemiology, and that's how to the public health specialists to plan, and policymakers to make appropriate policies to control the pandemic in the future, learning lessons from the past. So you all know, just but still the repetition, I would like to tell that's how confirmation, it stops the domino effect. If we identify the case and isolate that person, so we stop spreading. So that's very, 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 very important. So that's the very reason WHO promoted us test every suspected case and isolate. So we are still practicing it. There were queries: are we doing the right thing? Testing on asymptomatic cases and isolating them, is it worth it? Still, the answer is yes, it is, because when we reduce the number of cases by testing asymptomatic cases and isolating them, we can reduce the number of symptomatic cases coming from the community. So that's what we are practicing, still practicing. And I hope with that we are buying time, and Sri Lanka has got nearly 50,000 cases, just above 50,000 cases, but still our critical care and hospital capability, and we are not overwhelmed yet. So because of this testing and isolating the asymptomatic cases, I believe so that's still working good. Still, our cases are steadily increasing, but still the symptomatic cases are kept manageable number. So, so what are the challenges of people love PCR, people talk about PCR, everyone knows, yes, good, well, but still, is it a good tool for community surveillance? So considering the cost, so in Sri Lankan rupees, it's around 8,000 rupees a test. So we have spent around 365,000 million rupees in that. So whether it is in long term, it's good or bad, no one knows. So the cost is the problem. Second is turnaround time. So PCR is a batch test. It's not a single test. So when we have to collect the samples and each batch we need to test. So, and the number of samples ever increasing. So every day, each lab performs 2-3 labs, and many of the labs still perform manual extraction. So automated extraction is it's available in limited capacity. So we still depend on manual. The turnaround time was 48 hours or sometimes 72 hours. So, and all positive results, and that's a very, very important thing. All positive results do not necessarily indicate the infectivity of the person. So when we detect cases with CT value 30, 31, 32, we still report as positive, but that doesn't mean that patient needs isolation or in institutional quarantine. But we cannot control. When we issue the report as positive, with or without CT value, the public health team will consider it as positive and bring that case to the institutional quarantine under the country's current policy. So the PCR has, and at the same time, when we receive the sample and issue the report after 48 hours with the CT value 15, sometimes 12, and I have reported CT value 7. So that kind of high viral load samples or the test results will be issued after 48 hours in a community surveillance, person in the community. So whether is that useful or we need to find out an alternative. It's always we have been thinking about that. And whatever the level of coordination, we can have the interruption of supply chain because of the global pandemic and global supply chain issue. And we also have issue with lack of trained laboratories. Very few MLTs, the medical laboratory technologists, are trained in this the PCR technique. So it's a high skilled work. And we need a lot of training and dedication, very importantly, dedicated staff needed for the testing, because they spend time in the lab, manual extraction of 200, 300 samples a day. So they have to spend nearly 4-5 hours in the lab with all these full PPE. So they need a lot of dedication and a lot of skills. So those very few, you can count the number of MLTs performing PCR in Sri Lanka. They are countable, still countable. And when we have high viral load samples in high amount, so the laboratory contamination is another issue that we need to tackle. And we had issues. And I think every molecular laboratory working with this COVID thing, they probably must have experienced the issue with that. So those are the challenges we are facing with the real-time PCR, especially doing community surveillance using RT-PCR. So what's the better option for community surveillance? So you all may have seen and noticed and experienced this, the test rapid antigen. The struggle we had with RT-PCR can be, at least in part, can be helped with this rapid antigen test. So this lateral flow immunochromatographic assay has many advantages over the PCR, even though it has its inherent difficulties or errors or problems. So advantages and challenges. So when we consider the advantages, very easy to use, anyone can do it. Turnaround time, 10 to 20 minutes, and compared to the RT-PCR, 2 to 48 hours. obviously less cost. It costs around 1,000 rupees when you when you consider PCR is 8,000, 8 times lesser cost. And it identifies highly infectious people in the community. So it usually picks up people who have CT value 25 or less than that. So highly infectious people, rapid identification. So then and there, you can isolate them. So that's the advantage, very good advantage when compared to PCR. But there are challenges. It may give false positive results if the pretest probability is low. Or because it's a lateral flow assay and it's not performed by the well-trained laboratory people. It's a point of care testing and performed by the field healthcare workers. So the reading error can be also a possibility. So if the pretest probability is low, or the subjective reading issue, reading of the strip issue, or that sampling error, all might give rise to false positive results. The problem with false positive result is Sri Lanka is still practicing institutional quarantine of all the positive cases, whether they are symptomatic or asymptomatic. So if there is a false positive case and an asymptomatic false positive person being put into an institutional quarantine with all the other positive cases, that person is vulnerable to contract the illness. So that is the concern about this rapid antigen test widely being performed at the community. So the amendment is still on the way. Positive results in asymptomatic cases and negative result in symptomatic cases should be confirmed with PCR. So if we practice that, we can reduce the workload of the PCR laboratories because it filters out and it sends us only the positive cases for the confirmation. So that we can manage and we can cope up and cost effective. And so those are the challenges, and but it can be worked out and we can still utilize effectively this less costly, easy to use point of care testing for community surveillance. So at the same time, the role of laboratory in controlling the pandemic, it should not forget the biosafety and biosecurity. So the biosafety starts with proper sample collection, packaging, and transport and reception. So with all this pandemic and such a number of samples coming in, we still maintain the 3-layer packaging using the very available resources. So so that the primary container, which contains a sample and the label properly, and the secondary container, usually these Ziploc bags with or without the biohazard symbol with availability, and the tertiary container is usually the plastic container, which is also a reusable one. Usually that comes with our paracetamol or other tablets comes in this plastic container, so that the pharmacies used to discard them all this time, but now it has got an efficient, very useful thing. So we are using this as those containers as a tertiary container. So 3-layer packaging and all the community surveillance samples coming in this 3-layer packaging. And all the PCR laboratories have this symbol, and authorized personnel only can go in. So no, very limited access. And all the primary workflow is being done inside the biosafety cabinet. So that is to protect the sample, protect the user, and protect the environment. And the laboratories have now the Ministry of Health issued the autoclavable bags. So then all the waste is collected in the bag and autoclave, and then only it's going for incineration. So the laboratories concentrate on their biosafety as well as the biosecurity. So at the same time, any laboratories should practice quality control and a valid data entry program. So that the WHO is coordinating an external quality assurance program, and we all have registered in that, and so it's a closely monitoring system is ongoing. And there's a national COVID surveillance system is in place, and all the data, negative and positive and everything, with that format we enter every day. And all the positive results are emailed then and there to the epidemiology unit. So the data management and the external quality assurance in place, and it's being practiced. So those are the main things that I wanted to share with you all. And thank you very much for the Dr. and the Society of Microbiology. And I would like to answer any questions if there is.
Thank you so much, Dr. Vaidehi, for such a wonderful uh, sharing, actually, with the current situation of the COVID pandemic, particularly in our district, the challenges you face, and whatever the services that you are undertaking. But we just say PCR antigen, that's it, positive, negative. But behind the scene, we know what are the and everything that you face. So thank you so much for sharing that with us. So please, I would like to kindly invite the audience. If you have any questions, I will give you 3 minutes, minimum, well, the maximum 3 questions to be answered by Dr. Vaidehi. Can be international or national participants. It's over to you.
I would like to ask one question, ma'am.
Yes, please.
In Sri Lanka, what is the role of microbiologist? Which microbiologist? General microbiologist I am speaking, not medical microbiologist. In the COVID lab or in creating a COVID awareness, involvement in the government laboratories, whether our students, microbiology students, are playing any role?
Yeah, in Sri Lankan settings because the medical microbiologists playing a role in diagnosis and managing things. I think the other microbiologist involvement is very minimal, that we should encourage. But there are some universities, especially the University of Srijanathanapura, there are the research students are doing wonderful jobs, and they are the ones you doing the sequencing as well. So it can be done. It should be done, but at present it's happening in very minimal role. But we should encourage the microbiology people to involve in this, especially in the laboratory part.
Okay.
Thank you. So any more questions, please?
I can see Mr. Prakash Velapan has raised his hand. You need to ask any question. Does he want to ask?
Mr. Prakash Velapan.
Yes, madam. Thank you very much, Dr. Vaidehi. You have given a very good presentation. That is very nice. And I want to thank you that you are doing a very good job in our region, particular region. I understood the public also are very aware about your contribution during this COVID-19 season. I want to ask one question, madam. The process of the COVID-19 control in our region, what are the prompt action has been taken in part of our Estern University medical faculty? But you are attached to the medical faculty and you are attached to the general hospital. Do you have any plan to combine process or actions to be taken on regard the control of the COVID-19 problem? Do you have any ideas? I don't think there are any action has been taken by the university side, because I heard that Jaffna University, they are doing PCR test and everything very good in the university. But our university, I think they are not taking any action. What about your idea about this, madam?
Yeah, universities are very difficult, because when we receive students and they are living in the hostels, so the congestion is inevitable. But still, but they are practicing but our plan in our Faculty of Healthcare Sciences, those who are coming from outstation to the hostel, before they come here, we do the testing. So yesterday also we had a screening test with rapid antigen, and all were negative. 140 odd tests, all were negative. So then we take them in, and with the strict standard infection prevention measures, hand hygiene, masking, and not prevent any gathering in a closed space. So promote them to be in outside when they want to have a discussion and other things. Even for meals outside, we promote. And during our clinical clerkship at the hospitals, we break the groups into very small groups. Each group has only 6 students in it. It's 12, 24, now it's 6. So then reduce the number, and we don't have any large group lectures at present, only the small group discussions. All the practical sessions were reduced to not more than students at a time in a closed space. And we promote staff and students by using alcohol-based hand rub. And actually, our department has been producing in-house alcohol-based hand rub for the entire university. So then, to promote that less costly but more efficient preventive measure. So we cannot 100% prevent anything, but we will try our best to minimize the spread of infection within the university. For the time, we should anyway open up, close the universities forever. So with that opening up, we should be vigilant. And under the current guidelines, we cannot quarantine students who are coming from outstation or in-station or anywhere, but we need to allow them to move in. But we are planning to do a random screening. We educate them if they have any symptoms not to come to the appointment or lectures or anything, but to be in the hostel and contact. And we have given 2 academics numbers. Contact immediately, and we will arrange testing. And yeah, so those are the things we are trying our best to minimize the spread of infection within the university.
Okay, thank you very much, ma'am. Wish you all the best. Good luck.
Thank you very much.
So much, Dr. Vaidehi. Again, I'm taking this opportunity to thank you on behalf of the Eastern Province, our community, as well as all the district people, because what you have been doing is a wonderful job, right? Being a microbiologist, not just the service, your kindness. Again, I would stress here, and you are the wherever the problems are there, you are available. It's accessibility. So the confident on you for the public. So that's really grateful to you. So on behalf of the university and on behalf of the Microbiologists Society and with all sort of communities, I think I'm very much privileged to extend my gratitude and all the very best to continue your service to our district at this very crucial moment and the period. I think your service still we needed. I think all the very best. God bless you. We pray for you to give all the strength further and further to serve for all the public. And I have seen the comments, very excellent presentation. So many people are just putting their comments, very excellent presentations, as well as it's very practical. And we have got to know what has happened behind the scene in the laboratories, apart from this, what we are talking, just positive and negative. Thank you so much, Dr. Vaidehi.
Thank you very much, madam. Thanks.
All the best. With that, let me call upon that invite our next speaker. The topic is on nutritional immunology and its possible role in COVID-19 like infection. Dr. Sanjeev Padnakar is the president of Microbiologists Society in Goa, India, and Maharashtra state, and he's a life member of the Microbiologists Society as well. Let me give a brief introduction. Dr. Padnakar, sir, Dr. Sanjeev Padnakar. PhD in microbiology from Nagpur University. He is having more than 35 years of teaching experience in the as an academic as well as an administrator. He has served as assistant principal in Sri Shiva Prasad Sandal Jaiswal College, that is in district Gondia, Maharashtra again. His research has minor research projects, microbial production of glucose oxidized, and undertaken young scientist projects as well as gluconic acid production by solid state fermentation. And then the major project has fortification of tribal food and micronutrients by fermentations. Then, as major project, microbiological, phytochemical, and biochemical studies of Savas and Aristas. Then, apart from that, he is having more than 20 research papers published in national and international reputed journals. And he has been as an invited speaker from the Microbiology Society. He has been attended many conferences and internationally. Also, he has books through the Lambert Academic Publication, Germany. And as a collaborator, he is having the collaborations with the National Institution of Nutrition, that is ICMR, Hyderabad, Kshatriya, Institute of Medical Sciences, Nagpur, then Pragati College of Engineering, again from Maharashtra. And very particularly, I would like to say that as an innovator, he has that three newly isolated bacterial strains that are assessed and for their commercially important activities in culture collection centers. That is the Pseudomonas species as well as Pseudomonas IEMB, that is Aberdeen University, UK, and also he has got the extra member as well as global fertilizer. So with this introduction, thank you very much, sir, for accepting my invitation, Dr. Patnakar, sir. And I would like to kindly invite you now to deliver your testimony. Thank you.
Hello. Hello, am I audible?
Yes, sir, of course.
Yeah. So, very good morning to all of you. I am very much thankful to Dr. Chandrakantha Mahindranathan for inviting me for this international webinar on coronavirus spread and control. And I am all in collaboration with Microbiologists Society India. Before me, and I am also thankful to you for my lucid introduction. And before me, the two speakers they have given, they have deliberated. The very first one, it is on the COVID-19 and its effect on women by Dr. Anjana Singh. Positive and negative things she has told, and these are two lectures. They are very much interesting, and we got different type of information which is happening in the neighboring countries as such, particularly in Sri Lanka. I am very much uh, impressed with the work of Dr. Vaitehi, what she is doing in the COVID-19 lab for the detection and testing. So I wish her a good luck, and it is a service to humanity, particularly she is doing. So all the best, and the microbiologists, they are involved in this fight against the COVID-19. And my topic today, it is on the role of nutrition or the nutritional immunology in the infections, and possibly the role in what the COVID-19 like infection. So this is what the thing that I have to explain, that how the nutrition is can play a role in what in the such type of infections. I got certain type of the things from the very first lecture, the positive and negative effects, and in that they what positive effect it was there, and what the negative, particularly the negative effects that we got, and how the people are stuck up, how the people are losing their jobs, or how they are working, and there are so many other things I came to know. The similar things, they are also happening in India. So I would like to share regarding the nutritional immunity and its role, possible role in the COVID-19 like infections. So just a minute. So is it visible? Can you see the
Yes,
slides?
of course. Yes, sir. We can see that.
Okay. So is it okay?
Yeah, that's fine. That's fine.
Yeah, yeah, fine, sir.
So this is my today's topic, the nutritional immunology and its possible role in COVID-19 like infections. Now, to start with, in a very preliminary way, I would like to explain regarding the nutrition and something about diet and all other things and the various situations that we are facing in developing countries particularly. So, nutrition, that all of you know, that it is nothing but the nourishment element, and it refers to what? The nurturing of our body. So, to keep it healthy and functioning as it's supposed to do. Now, there are, when we talk about the nutrition, then it is what? It is nothing but our daily intake and nothing but the food. So, nourishment which we are getting or which we are taking via food. So there are different type of food, variety of foods they are available, and the pattern of food that changes from country to country, community to community, environment to environment, and as such. And these variety of foods they are available for the mankind to consume and to become healthy. Now, we consume it for the maintenance of health, good growth, development of resistance against the infections, and so on. Now, if you go in the history of the nutrition as a science, it was developed or it was found by Lavoisier. Lavoisier, he was a chemist, and he is called as the father of chemistry. He looked into the our food pattern, and he found that this food is nothing but it is an organic food, and he started thinking and interpreting how the components of this, the chemical components, the organic components which are present in the food, how they are going to affect our health. So what he did, he developed a scientific way in order to interpret the components of food, that is we call as the nutrients and other substances in the food, in relation to what? In relation to the maintenance, then the growth and reproduction, health, and the disease resistance as such of an individual. So it is what? It is nothing but a way of interpreting the components of the food, and that is called as the scientific way, the nutrition. So it was established in 18th century, and so we can call this nutrition as the one of the youngest type of the branch of the science. So here, what is the relation of between the nutrition and health as a whole? Now, when we talk about the health, the definition of health which is given by World Health Organization, it is what? It is nothing but the state of complete physical, mental, and social well-being, and not merely the absence of any disease or inability. So that is what? That is nothing but the health. So here, nutrition, it is how it is related, or what is its function, or how it relates to the health. Now, as we know, the entire growth and development, it is dependent on what? It is dependent on the expression of genetic potential or expression of our genetic abilities. And the genetic abilities expression, it is nothing but what? It is nothing but the protein expression, and the protein expression, it depend on particularly the enzyme production and all other things. They depend on what? They depend on the protein synthesis. So we need what? We need the all type of the components for the protein synthesis, amino acid synthesis, that is what? The carbon, nitrogen, and all, we derive it from the nutrition. So the genetic potential also, it depend on the nutrition. Then maintenance of the structural integrity, functional efficiency of the body tissues necessary for an active and productive use. As I told just now, the World Health Organization, they gives the definition of health, where it include the mental well-being or the mental status, and the social well-being also. So mental well-being, it is also related to what? It is related to the nutrition, because the nutrition, it directly affects what? The energy generation, and the energy generation, it needs what? The highest energy requirement, it is the brain tissue. So ability to withstand with what? The inevitable process of aging. Because what happen, if we have a good type of nutrition in our younger age, then there will be a full expression of genetic potential, and we have a proper type of the physique and then the fitness, which will give a minimal disability and functional impairment during the process of aging. So if you eat healthy, if you have good type of nutrition in your younger stage, it will pay off in what, in the older age, without giving much more physical impairment or like that. Then ability to combat disease, so resisting the infections, immunocompetence. So immunocompetence, it is also dependent on what? It is also dependent on the nutrition. Now how it will be dependent on nutrition, how the nutrition affect the immunocompetence, that we will see in the forthcoming slides. The immunity, it is of two types generally: the T cell, that is the cell mediated immunity, and the B, that is the humoral immunity. In both the cases, we need what? We need the involvement of protein factors. In humoral immunity, directly the antibodies are formed, and in this cell mediated immunity also, the development of different type of factors, cytokines, and so many other things, where we need what? Where we need the requirement of protein synthesis, which are affected by the nutrition. Apart from that, though the T cells or the lymphocytes, they are produced. Now those lymphocytes, mere production of lymphocyte it is not useful, but its proper placement and homing at a particular place, that is at the site of inflammation, it is necessary. For that also, the certain protein factors are required. So they are all synthesized depending on what, how you get the nutrition. Then preventing of the onset of degenerative diseases, resisting the effect of environmental toxins and pollutants, and so on. So there also we need the help of nutrition. Now, immune system, in a quick way, as you know, it is what? It is the structure, biological structures and the processes within an organism that protects. Then it has got an immune system, must detect a wide variety of agents from bacteria, viruses, parasites, worms, distinguish them from the organs, health, tissue, etc. Now immunity deals with what? The functioning of immune system, and inhibiting what? Inhibiting the harmful organisms and other external influences. So now immunity, as you know, all of you, so it is what? It is of three types, that is the surface factors, epithelial factors, right from skin and the epithelial lining of the intestine, in the lungs, and so many other things. Then the innate immunity, that is what? The immunity which you inherit. And then the acquired immunity during your lifetime, it may be the active or passive, and it is of. Now all these immunity factors, they involve the humoral and the cell mediated immune factors, how they are regulated by the nutrition and how they are related, that we have to see. Now we come to the diet. How the diet, now again, we had seen the nutrition, the slight difference between the diet and the nutrition. What is diet? It is nothing but it is the sum of the food consumed by a person, and it is the use of specific intake of nutrition for the health. So what we take in the diet, that will provide you what? That will provide you the proper type of nutrition, and those components which are present in the diet, they are the nutritional components which is vital for healthy immune system. Now nutrient deficiencies and excess can harm the immune system. Both innate and acquired immunity, it is affected in malnutrition. Now in the developing countries, particularly in the Asian countries like Bangladesh, Sri Lanka, India, Pakistan, Nepal, now the malnutrition, it is much more, and there the effect on immunity, particularly in the children and women, it is much more. So some foods can stimulate the allergic reactions. Nutritional, now here the nutritional immunology, it is a branch which has been developed. Nutritional immunology, it is nothing but it is a field of immunology that focuses on study about the influence of nutrition on immune system and protective functions. So we had to see how the nutrition affect the immunological status of a host, and then how it affects the protective function also, and what is the role of this in the COVID-19, and what should be the reason why the people get affected. Is there any nutritional factor also involved in the in contracting such type of the infections? So that is what the question, and that we have to see. Now here, this is what it is: a network of interactions between the nutrition and immunity. Now the diet affects the nutritional state and immune status, both of which interact with what? Now you can see here, both of which interact with the microbial community. that is the microbial symbionts, commensals, pathogens, to affect the fitness of all partners. Now here, because of the nutrient feedbacks, now host nutritional state is there, and the nutrient feedbacks modulate the feeding behavior. So nutritional feedback, it gives what? It gives the modulation of feeding behavior of an individual, and the potential of the host that exists to adjust its diet, to optimize its microbial interactions, and to increase what? To increase the resistance. So here, what happened? The feeding behavior, the modulation occur, and accordingly, the diet, it is adjusted. So host immune function, it will give what? It will give the interaction with the microbial community, and then because of that, we can increase what? We can increase our resistance. So in all, the diet and the nutrition, it gives what? It gives the impact on what? Impact on the impact on the immunity as such. Now alternatively, what happened to the parasite? Alternatively, the parasites and the pathogen might subvert hosting feeding mechanism or the feeding behavior to their nutritional advantage. So that is another factor. In this way, this interaction, this is a network of interaction between what? Between the nutrition and immunity that takes place, and then the ultimate or the resultant immunity that we get. Suppose our nutrition is good, then in that case, the resultant immunity or the resultant will be what? We can fight against the infection. If the nutrition is bad, then in that case, we cannot we cannot interact, or we cannot counteract with the infecting agents as such. So we'll go for the malnutrition. What happened in the malnutrition? Now malnutrition, it is what? It is the it is recognized as what? Malnutrition and infection, they are what? They are the two sides of the coin, and they are the two major obstacles for the health, development, survival worldwide. And the poverty and the ignorance. Now this ignorance is very, very important. Today also, there is an ignorance in many aspects, because of which the COVID may again research, and it may give what? It may give a problem. So the poverty and ignorance are the most significant contributing factors. Infection and malnutrition aggravate each other. In fact, the malnutrition is the commonest cause of immunodeficiency worldwide. Now this is what the immunodeficiency, it is in general. So when the malnutrition occur, immunodeficiency is there. If you look at the Asian countries, particularly in the Southeast Asian countries, and particularly in the India, Nepal, then Pakistan, Bangladesh, and the Sri Lanka, the malnutrition problem, it is much more. And because of that, the immunodeficiency, it is also there, and we suffer from different type of infections and pandemic very easily. We become the target population. Now, there are many causes of increased susceptibility to infection among the underprivileged and the malnourished community. The lack of proteins, vitamins, and minerals in protein energy malnutrition lead to changes in the immunocompetence, in the cell-mediated immunity, the bactericidal function of neutrophils, complement system, and the secretory immunoglobulin A, that is the IgA. So lack of health education, illiteracy, contaminated food and water, poor sanitation, overcrowding. Now this is going to be a big problem in India, like in Mumbai, Kolkata, then Chennai and Delhi. The overcrowding, it is what? It is worsening the situation. In the Maharashtra, particularly in Mumbai, what happened? The outbreak or the increase in the cases of the COVID-19. Why it was spread like that? Because particularly in the Mumbai, there are certain areas like Dharavi slum and all other things where the overcrowding is worst, and because of that, the spread of disease, it was more. As the crowding is there, overcrowding is there, naturally the poor sanitation is occurring, the water and the food quality, it is also undergoing to a very bad level. And then the illiteracy, it is what? Lack of health education. These are the contributing factors. So now obesity, it is associated with the adipose tissue inflammation and increased risk of infection. Now regarding the obesity, on one hand we have a malnutrition, and on another hand it is what, on the other hand we are having what, we are having the obesity. Now there is an interesting report I can share with you from the National Family Health Survey of India. It has come just now. This is a survey for 2019 and 20 year. When the pandemic start, after that the survey it was carried out, and it was found that during this year there is what, there is an increase in what, there is increase in the malnutrition, particularly the malnourished children. Previously it was 9.4%, it has gone to nearly about 10.5%. And on the other hand also there is another picture that the obesity also increased, that is from 3.4 to 5.5%. Now the obesity, it has also gone. Now the as the madam Anjana madam was saying, that the positive and negative effects. So in that, if you see this malnourishment and obesity, now this is what again a particular effect that we have seen in the COVID-19. The obesity increase. Why? Because the people are staying at home. Some people they are they are staying at home and they are sitting just like that, observing TVs, and only there is no physical exercise, nothing like that. On the other hand, there are certain people, those who are not getting the food properly, and they are exerting, nothing like that, because of for what? For earning the money, because their jobs they have lost. So because of that, both the things we have seen, and both are what? Both are very bad for the situation. So the obesity is also increasing in the the COVID-19 situation. This is the survey that says. So obesity is also associated with the adipose tissue inflammation and increase the risk of infection. Inflammatory markers secreted by abdominal adipocyte tissues suppresses the replication of both T and B cells. So the inflammatory markers are produced by the adipocytes, abdominal adipocytes. And the leptin, a hormone which is produced by the fat cells, also support the white cell production, which in turn enhances the immune function. Obese people have high levels of leptin, but their immune cells and the phagocytes have become unresponsive because of what? Because of the inflammatory markers which are secreted by the abdominal adipocytes. They suppress the replication of T and B cells, and that's why the responses are immune responses are very low, and they are very poor. These impairment, they have gone. These impairments as such are reversible with adequate weight reduction. So if the reduction in the weight, then these impairments can be reversible. So after that, now other factors like the hormones. Hormones can act immunomodulators, altering the sensitivity of the immune system. Steroid hormones directly suppresses the B and T cells. Female sex hormones are known stimulators of both adaptive and innate immune response. Estrogens may also influence how some antigens are processed and cause the autoimmune diseases. And there are autoimmune diseases like lupus erythematosus, which strike the woman at the time of puberty. In contrast, male sex hormones such as testosterone become immunosuppressive. Now, this is how the heavy exercise or excessive exercises or excessive physical work, which increases what? Which increases the testosterone levels and can reduce the immunity. So the workers, they go for high physical exercise, they exert much more, and because of that, the testosterone level may increase and it can reduce the immunity of such people. Other hormone appear to regulate the immune system as well, most notably the prolactin and the growth hormones and the vitamin D. Now, vitamin D is crucial to activate our immune defenses, and without sufficient intake of this vitamin, T cells will not be able to react and to fight off serious infections in the body. Now, how it act and how it promote the immune system, that we will see in the next coming slides. Now, if you see the Indian diet, the cereal-based Indian diets, qualitatively deficient in the micronutrients like iron, calcium, vitamin A, riboflavin, folic acid, and vitamin D. Now, if you see the dietary etiology of micronutrient deficiencies, now the malnutrition, it is of two types. One is of macronutrient deficiencies, other is the micronutrient deficiencies. Now, macronutrient deficiencies, they will give what? They will give the protein energy malnutrition and then the other kwashiorkor and other type of such diseases. But micronutrient deficiencies are more troublesome and they are more dangerous. Micronutrient deficiencies include the deficiencies of vitamin, minerals, and so many other things, though the people, they are getting the macronutrients at a proper level. Now, the repeated diet surveys done by National Nutrition Monitoring Bureau, NNMB, situated at National Institute of Nutrition, ICMR, in the 9 states of India, and some other surveys indicate that the cereal-based Indian diets are qualitatively deficient in micronutrients, particularly iron, calcium, vitamin A, riboflavin, folic acid. Now, these give what? These give the hidden hunger. What is this hidden hunger? You are getting the macronutrients properly, but they are not metabolized because these micronutrients are not present, and the micronutrients cannot support the different type of, and without micronutrient, the enzyme cannot support for the different type of metabolism, and the energy deficiencies may occur, though the person having a good type of carbohydrate and protein and the fat intake. Now, this is because of what? This is because of the low intake of income elastic protective foods such as the pulses, vegetable, particularly the green leafy vegetables, fruits, and foods of animal origin. So this is the reason why the micronutrient deficiencies occur in the developing countries as such. Now, what are the consequences of micronutrient deficiencies? They are very serious. Now, apart from the human suffering due to morbidity and mortality, the malnutrition in general and the micronutrient deficiencies in particular have a high economic cost. The productivity loss due to the poor nutrition are estimated to be more than 10% of lifetime earnings of an individual and 2 to 3% of GDP to the nation. Now, cost of treating malnutrition is 27 times more than investment required for the prevention. So this is the micronutrient deficiency that is also present in many more other developing countries as such. Now, some common nutritional deficiencies: prevalence of anemia in all groups is higher in India. Then dietary vitamin D intake is very low in India. Low consumption of vitamin D rich foods, absence of fortification, low use of supplementation. Now, if you look at the relation between what? The disease and the malnutrition. Now, this is a vicious circle. Inadequate dietary intake, weight loss, growth faltering, immunity lowered, mucosal damage. It will give the disease, increase in the disease incidence, severity, and duration. Because of that, the appetite loss, nutrient loss, malabsorption, altered metabolism. Again, it has giving the weight loss. Then it gives the inadequate dietary intake. So this circle goes on, and that is the situation because of what? Because of the micronutrient deficiencies and the malnutrition. Now, vitamin and minerals which support the immune function. Now, these are what? The epithelial barriers. For that, the vitamin A, C, E, and zinc. For cellular immunity, vitamin A, B6, B12, vitamin C, vitamin D, vitamin E, folic acid, iron, zinc, copper, selenium. They are required for antibody production. Vitamin A, B6, B12, vitamin D, vitamin E, folic acid, zinc, copper, selenium, they are required. So this is the contribution of micronutrients in what? In the immunity. Here, if you look at the vitamin A.
Excuse
Now,
me, sir.
yeah.
No slide visible.
Okay. Just a minute. Is it visible? Hello?
Yes, sir.
Yeah.
Yes, sir.
It is visible, sir. Yeah.
Visible? Okay. Okay.
Yes, sir. Yes.
Yeah.
Yeah, it is
So
visible.
vitamin A. Now, vitamin A exists in different organic molecules in the form of different organic molecules like retinol, retinoic acid, and it is an essential nutrient which is needed in wide array of aspects, including the proper functioning, for example, the visual system, maintenance of cell function, uh, differentiation, epithelial surfaces, integrity, then surface integrity, erythrocyte production, reproduction, normal immune functioning, etc. Now, the vitamin A, it has got a metabolite that is retinoic acid. Now, this retinoic acid, it plays an important role in the immunity. It gives what? It gives the gut homing of homing receptors on what? Gut homing receptors on the T and B cells, allowing the trafficking of both these cells to the intestine and to the inflamed areas to perform their effector functions as such. Now, how it happens? Now, uh, it has been found that this RA, that is the retinoic acid, have dual effect. That is, it modulating the regulatory T cells differentiation in the steady state while promoting the cell activation and the T helper 1 and T helper 17 cell responses during ongoing immune responses. Vitamin A supplementation reduced the childhood mortality due to measles and diarrhea. Now, this is what the how the retinoic acid works in the cellular immunity. Now, this is the lamina propria of the intestine and the mesenteric lymph node. As you can see here, this is the mesenteric lymph node. It is there, and then in this mesenteric lymph node, the dendritic cells are there. Now, this dendritic cell, they contain the integrin, that is the CD103 plus. Now, this factor, it converts the retinol into the retinoic acid. As soon as this retinoic acid form, retinoic acid initiates the formation of what? Formation of this alpha 4 beta 7. Initially, there is no alpha 4 beta 7 factors are there. As soon as this alpha 4 beta 7 factor occur, it comes into what? It comes into the lumen, and there in the intestinal lumen or in the lamina propria, there are what? There are high epithelial venules are there which develop this particular receptor that is called the MADCAM1. Now, to this alpha 4 and beta 7 receptors, they join, and because of that, the homing of what? The homing of the T cell or the T lymphocyte takes place in what? In the lamina propria. At the same time, the retinoic acid, it initiates what? It initiates the formation of what? Formation of the CCR9, that is the chemokine receptor. It develops on the surface of the T lymphocyte, which can detect the CCL25, that is the chemokine developed by the inflamed area. So the cell can migrate there and join to what? Join to this inflamed area. So if the retinoic acid is not there, or if the retinol is not there, then the T lymphocyte, though they are produced in your lymph node, they cannot go inside the lamina propria and give the homing as such, and can do the effector function. So the vitamins or the vitamin A, it has got this role. Without vitamin A, lymphocytes, if they are present, they cannot work. They are what? They are the bare lymphocytes as such. So this is what? This is the retinol. Now, how the retinol it act? It affect the monocyte, it affect the macrophages, T lymphocyte, myeloid, then the NKT, natural killer T lymphocyte, neutrophils. It can affect the bacteria also. Mucosal barriers, it can develop very well. Retinoic acid, it helps in the adaptive and the adaptive immunity, that is the B cell development and T cell development. So these are what? These are the advantages of what? The retinoic acid, and how the vitamin A helps in the immunity. So vitamin A helps with the development of immune system function, promoting mucus. Mucus is a defense mechanism against bacteria and virus. So in the lung, as lung airways, and in the intestine also, the mucus, it is developed by the vitamin A. Vitamin A develops helps in the development of antibodies required to fight the infection. Then vitamin C, it gives the collagen synthesis, stabilization, protects the
Dr. Patnagar, sir,
yeah.
Dr. Patnakar, sir, sorry for interrupting. Would you be able to finish it under 3 minutes time? Your talk, if you
Uh,
don't mind. Another 3 minutes
how,
time.
how much?
Okay. In other 3 minutes time.
Uh, uh,
Maybe maximum 5 minutes. Okay, you can take another 2 minutes additional.
there are so many functions of the vitamins as such. Then I will straightly go to the vitamin D. Now this vitamin
Okay.
D, the
Thank
vitamin
you.
D, it is a very important type of vitamin, and it modulate by the both ways. That is in a positive way and in a negative way. It gives what? It gives the uh, it works again on the dendritic cells and do not allow the formation of what? Formation of cytokine. On the other hand, it gives the development of the T cells, which will give what? Which will give the protection by the different ways of mechanism. So the other, now there are different forms of the vitamin D. One of them is what? One of them, it is the 125D, that is the calciferol. It is very much helpful in the different type of infections. So this mechanism I am not going to give in the detail. So vitamin E also has different mechanisms. Then after that, the vitamin B12. This vitamin B12 is also very much important in maintaining with the cellular immunity, CD4 and CD8 ratios, and it is helpful in what? In the DNA synthesis. It has got a function in what? In the T cell differentiation also. Then cytokine developments also. So apart from that, the B6, it can give the more than 100 metabolic reactions as such, which gives it. It also help in the IL-6 TNF alpha levels. It is helpful in the arthritis. So B6 supplementation. So folic acid, all of you know the folic acid, it is very, very important. It plays an important role, and B6, vitamin B12 and the folic acid, they are useful in the immune development. So iron, it has got a very high role in the lymphocyte activation and the proliferation. So these are what? These are the various uh, factors. Then the zinc, it is also useful in the development of immunity, in the lymphocyte functions, and so many other things. Then the fibers which we are using are giving the healthy type of the gut layer, and because of that, it doesn't allow the penetration of microorganism inside the gut. Then the probiotics also plays an important role. Particularly, it gives the development of what? Development of different type of things. That is what? The beneficial effect, health promotion, inhibition of carcinogenesis, high calcium resorption, ANFs, that is anti-nutritional factors, vitamin, riboflavin, folic acid, pyridoxine, niacin, protein digestion. So B12 production, it is very, very important. So now what is the possible role of nutrition in COVID-19? At present, the entire world, all of you know, it is fighting against the COVID-19, and some points, that is the mode of transmission, it is the aerosol, close contact, target organ, LRT. Then 85% people, they are the above 65, and the comorbidity, that is the CVD diseases. Then geographical distribution, it is highly populated cities, it was detected. RT-PCR, it is the diagnosis and it is given. Then physical and social distancing, it is the prevention. Prophylaxis, HCQ was limited, was used in a very limited way. Treatment, no drug available. Active immunization, vaccine just available. Now, in such situation, is there any way to protect? Can nutritional immunology play an important role in the proliferation in host body, delay further spread till vaccine or the drug develop? To answer this, we have to a quick look at the infections. Now, this is the way of infection. That is of what? That is of the how the COVID-19 virus, it enter via ACE2 receptors. Then it comes inside, releases the RNA, replication goes on, transcription occur, the protein packaging, and then again the release take place. So important is what? If the ACE2, that is the angiotensin converting enzyme 2 receptor. Now, how the vitamin D plays an important role. Now, how the kidneys, they give the renin. Now renin, it act on the angiotensinogen, convert it into the angiotensin 1. Angiotensin 1 convert into angiotensin 2 by the ACE, that is the angiotensin converting enzyme. Angiotensin 2, it gives what? It gives the various type of the cardiovascular diseases, and to overcome that, the ACE2, that is the angiotensin converting enzyme 2 develop, which degrade it. And this angiotensin 2, angiotensin converting enzyme 2, it is what? It become the receptor for coronavirus. So here the vitamin D, it is what? It inhibit the gene expression of renin. It inhibit the renin expression, it is inhibited, and because of that, the angiotensinogen, it cannot be converted into angiotensin 1. As angiotensin 1 is not there, there will be no further cascade of reaction, and the ACE2 cannot be developed. So if you have the better levels of vitamin D, that is particularly the 125 vitamin D, you are protected from what? You are protected from the infection. That is what? Infection cannot enter, or infecting agent may not enter. Now this is what, how the vitamin D. Now vitamin D, as I told you, it has got a two type of the effect, positive and the negative effect. It gives what? It gives the expression of what? It gives the expression of renin. It is prohibited. And another thing is that it gives the development, it doesn't allow the ARDS. This is what? The acute respiratory distress syndrome. Because of what? Because of the cytokine storm. Why it is so? In the earlier slides I have given that the dendritic cells are not allowed to form the cytokine. So as the cytokine doesn't develop, the major cause, that is the ARDS, which is occurring in the coronavirus infection, that can be stopped. At the same time, it produces what? It produces the antiviral substances. These are what? These are the antiviral substances. That is what? The LL37, in response to the indigenously produced 125 D2 and the D3 vitamin. So because of that, the coronavirus get prohibited. So at the entry point, and if it enter, it will be prohibited by these two type of the these two type of what? These two type of the defensins and the cathelicidins. As such, these are what? These are the two things. So the vitamin B12. Vitamin
Sir,
B12.
Patanka, sir.
Yeah.
Please conclude, because
Yeah.
the soil sir is waiting.
Yeah.
And
Yeah.
we'll
Now,
arrange again sometime. Your information is a very good, but there
just
is
a
a
minute.
time
Just a
limitation.
minute. Just a minute. Vitamin B12, it can inhibit the RNA polymerase, RNA dependent RNA polymerase. So the production of coronavirus may be stopped. So this is what? This is the situation. And then the probiotic culture, they produce the anti-nutritional factor which will inhibit the renin. So these are what? These are the valine, proline type of what? The peptides, they are produced by the probiotic culture. So if you take the probiotics as such and take the proper vitamin, then you can be protected from what? Protected from the corona-like infections as such in future. So these are what? These are the certain things. And in conclusion, we can say the nutrition plays an important role in the innate immunity, and we can have a better type of the control if our nutritional status is improved and we change our lifestyles. So this is the in conclusion. So thank you.
Thank you very much, Dr. Patnaka, sir, Sanjeev Patnaka. And I'm so sorry that we are running sort of time, because our next speaker is waiting. And it's very informative, very informative for this at this crucial situations, how we can balance through our diet this in controlling the coronavirus. Thank you so much for your acceptance as well as for participating. So let me welcome our next speaker. Thank you, sir, for waiting with us. Professor Dr. Abdullah Muhammad Shohail from Department of Biotechnology and Genetic Engineering from Dhaka, Bangladesh. So that you are, I think it's a I mean, I have to be say a word of thank you because for accepting my request with a very short notice, and you were able to, I mean, accept my invitation to talk about the COVID pandemic in Bangladesh perspective. So thank you so much for joining with us and accepting our invitation. Now this is over to you. And before that, let me give the brief introduction about Professor Dr. Abdullah Muhammad Shokil. He is a professor in the Department of Biotechnology and Genetic Engineering in the Jahanginagar University. I'm sorry if I spell it out. And from Dhaka, Bangladesh. Dr. Shohil has joined the International Rice Research Institute, IRRI, as a research collaborator after completing his PhD on agricultural biotechnology from Chungbuk National University, South Korea in 2006, where he worked on the overseas and he was working on drought tolerant mechanism in rice. While pursuing his JSPS postdoctoral fellowship from 2007 to 2009 at uh, Tsukuba University, Japan. His prior responsibility was to develop genetically modified lettuce plants harboring a taste modifying protein, miraculin. As a research associate of the University of Florida during 2009 to 2011, he attained a research goal successfully by developing a model on greening the canker-resistant transgenic citrus cultivars. He has joined a long research track on plant tissue culture, commercial production of plant cells through the bioreactor, food biotechnology, microbiology, and genetic engineering. He has published articles in many international national journals and books. Totally, there are 830 citations, among which high index, that is H index 15, I index 10, and then, sorry, I10 index is 16, and in the research gate score 20.47. Congratulations, sir. His key research interest to isolate the novel genes from genome engineering and genome editing approach to develop environmentally resilient plants. His areas of interests are metabolic metabolomics actually. So metabolic engineering, secondary metabolism, study from various engineered species and their conservation. He is also trying to establish institutional biosafety and biosecurity guidelines and procedures. He is very much keen to arrange campaign to create public awareness, which is really important, and motivations toward the new technologies. He is a life member of the Microbiologists Society India. So warm, very welcome, sir. Very warm welcome from Microbiology Society and also from Department of Botany, Eastern University, Sri Lanka. This is over to you, sir. Thank you.
Good afternoon. Am I audible and are my slides are visible?
Yes, you are. Yes, you are. And your
Thank you
slides are
so much.
visible.
Thank you so much. Good afternoon, respected colleagues and attendees. First international webinar on coronavirus spread and control, Department of Botany, Faculty of Sciences, Estern University, Sri Lanka. I would like to thank organizer for arranging such an important and timely event. And my special thanks goes to President Microbiologists Society, Professor Dr. Arvind Deshmukh sir. His inspiration is enormous, and he always inspiring us, not only us, I think, surrounding, out of India, surrounding countries, Nepal, Bhutan, Sri Lanka, Maldives, and many, Bangladesh, and many other countries. And we are collaborating with him, promoting science, microbiologies, different programs, and everything. For this instance, Arvind Deshmukh sir attached me here, connected me here, and this is my first meet with Sri Lanka, and obviously Dr. Chandrakantha and also Estern University. So I welcome all of you to my presentation. Uh, Actually, I was listening from the morning, very timely and very thoughtful thoughts about Dr. Anjana Singh, Dr. Raziban, and finally Dr. Sanjeev Patankar sir, who was explaining about the role of food and our immune response. And in his final slides, he was trying to explain about the vitamin D and others to boost up our immunity. And I think we need much more time to hear from him because he was explaining so nicely. So thanks again, all of the distinguished speakers who spoke here. In my talk, I would like to talk about this mix matched approach because about COVID pandemic and coronavirus spread and control, everybody's are aware about that. People are knowing much more that because I am not a medical doctor, I am not a laboratory microbiologist, so I am not much. It's not my specialty to talk about the coronavirus spread and control, but I would like to highlight some issues, some status about Bangladesh, and some future thoughts what we should do. So I am from the Jahangirnagar University, as it's my first talk in Sri Lanka. So it's my duty to introduce my beautiful university and campus. So it was established 1970. It's a public university and co-educational. Our honorable Chancellor is the president of this country, Mr. Abdul Hamid, and our Vice Chancellor, Professor Dr. Farzana Islam ma'am, Pro Vice Chancellor, two Pro Vice Chancellor, and total academic staff, I mean faculty members, 672, and students, 14,500 around. Its location is Shabar, just 30 kilometers, around 30 kilometers from the center of the Dhaka, and 20 kilometers from the international airport. It's a rural area, about 697 acres of lands, and we have very nice uh, architecture of the land, and where lots of lakes and reserve jungle, I do not like to say forest, but reserve conservatory plant reservations are there. And during the winter, millions of migratory birds are visiting our campus in those lakes. You can see some pictures are there. And then every day, thousands of people came to visit those beautiful scenario and this beautiful campus. I welcome all of you in the new normal area to visit Jahangirnagar University, and I am very much eager to cooperate with you, whoever is interested to cooperate with you. So now I'm passing through my presentation. As all of we know around the globe, microbiologists are making a big difference to our lives. I am not biased about the only microbiologist. I mean, who are those working on microbiology. So botanists also can working, biotechnologists are working, microbiologists definitely they are working, biochemists they are also working, because without microbes we can do any biological science research or advanced research. So microbiologists, they are really making a difference to our lives. Food security, food safety, disease prevention, treatment, green technology development, bioenergy production, GMO development. So all of those, and most important things, tracking the role of microbes in climate change. That's the important, and I'll highlight at the end of my presentation. So where microbes are not existed, this is the very crucial question. As we know, from the hot spring to the Antarctic region, everywhere microbes are there. And then we are getting benefit from those microbes in our daily life. Today it was discussed about the PCR, RT-PCR, those technologies are much more we are aware about. Even though those we have not heard before, but during this COVID pandemic, we already heard about this technology. So here also these enzymes we are getting from those this hot surface microbes. So microbes are everywhere, and they are doing our life better and better. In our planet is completely dominated by microorganisms. Half of the Earth's total biomass is entirely composed of microbes. And then our knowledge expanded, and our study and our research is going boosted up after the next generation sequencing technologies and metagenomics revealed, and we are using those technologies in our daily research. So this is our microbial planets, and everywhere, nowhere empty these microbes. So microbes is there. What are the key topics of microbiology? All of you knows better than me. So I am just talking about antimicrobial resistance, environmental microbiology, pathogenicity and prevalence, and then biotechnology and synthetic biology, microbiomes, food biotechnology. So everywhere microbes are here. Microbial decomposition of organic matter without this crucial function of microbes. Actually, what could happen even we can't imagine if the I mean lives can't be decomposed after death. So what would happen? We can imagine later. And then these human microbiomes, plant microbiomes, marine microbiomes, those interacting with our daily life. I mean, not us basically, whole biodiversity, whole universe, the whole systems of this earth are interacting with this human, plant, marine, all other microbiomes interacting together. Now I am going to the recent topic, this microbiological threat. Among all the threat, I will not discuss those. I will just talk about this coronavirus very little. Infectious diseases are a global hazard that puts every nations and in every person at risk in everywhere. The recent coronavirus outbreak, prime example, it's no boundaries about this coronavirus spread that we observed, not political borders. So this coronavirus arrived silently, lethally, and they are changing that already discussed. They are very peculiarly, they are changing their habitat, and then whole human civilization now under threats, and they are thinking about that, where we are going, where we should go, or what's our fall, that really we have to think much. Coronavirus, we already know this coming with fever, I mean, muscle pain, headache, cough, then dyspnea, and the contagions, human contact, air transmission, contaminated objects. And finally, this is the coronavirus structure. All you know and aware about that, so I'm not talking about the much. What happened? Potential losers and potential winners in this society. If we see, if we decode the economic impact of COVID-19, so we'll see, or we are already affected everybody in where we are affected like others. So potential losers during the COVID pandemic: tourism and leisure, aviation, automobiles, construction, real estate, manufacturing, financial services, education, oil and gas. On the other hand, some good news: potential winners, those are getting much more benefited or getting much from this COVID situation: agriculture, then ICT, personal and healthcare products, food processing, retail, medical supply and service, and e-commerce. All of you now order anything or buy anything or purchase, procure anything from your mobile or from your laptop, from your home. So this is e-commerce that bloomed. And then not renewable natural resources, fossil fuel supply, oil prices on silver, platinum, iron, gold. So some of those are dropped and some of those price hiked. Overall impact, tax revenue, currency strength of every country is dropped. Government economic capacities also shrunken. Then profitability of different farms also reduced, and continuous job destruction, research, development that I will focus later. In Bangladesh scenario, the virus was confirmed to have spread to Bangladesh in March 2020. The first 3 known cases are reported on 8th March. And then after that, 18 March, first death was observed. And then slowly is increase the cases day by day. And over the whole nation, this coronavirus spread. And government imposed the lockdown throughout the nation from 23rd March to 30th May. So it was the total complete lockdown. Only few, emergency services was open. Government launched app to identify COVID-19, and till yesterday, we have 531,799 confirmed case. Among them, 476,000 and 413 recovered, and total death up to yesterday about 8,000 death. Yesterday it was 20 death and 400 around 500 new cases was observed. So total recovery rate about 89.6%, and then 8.9% of the total cases they are receiving treatment. They are going to the hospital, and rest basically they are taking the home remedies and precautions at home. Right now we have none cases at the ICU, and daily confirmed case on average is 3,211 per million of population. So this is the baseline bar chart. If you see the coronavirus cases from December to till yesterday, these cases is drastically dropping, and we hope it will continue. So government has this call center, and up to December 29, this total health service provided is huge number of health service through the call center, different suggestion, different feedback, treatment, and everything. Now these active cases that I already showed, this is odometer reports that cases are really is getting down, and we believe this already. We got the vaccination from India, and we also purchased some. All of those vaccination already arrived in our country, and we are hoping from the next week this program will be start. Now I am coming what we have lost. Economic impact of coronavirus on Bangladesh. Estimated loss is huge. That total 1.1% total GDP dropped, and around 0.9 million people may lose their jobs. Actually, those are registered jobs, but how about others that also not in the list, because those have daily labor worker and those small businessmen and small holders, those are. So if those we can count, it will be huge number. So in Bangladesh, agriculture, mining, and carrying business, trade, personal and public service, hotel and restaurant and other personal service, light heavy manufacturing, utilities and construction, transport service, each and everywhere our economic crisis we are now observing. How about education? In Bangladesh, total 66,000 government primary schools, and 1 lakh secondary and higher secondary schools, college and madrasa, total 53 public universities, and 60,000 private run institute among, except the public universities and government secondary and higher secondary school, college and madrasa. So with the 53 public universities, we have 105 private universities, 5 crore students across the country, and then 104 above English medium schools are there. What were our constraints? 40% public university students, basically this not only public students, among the all institutes, lack of digital devices, internet connection. 80% drop in studying done by students. 15% private teachers changed their profession. 38% households lack internet connection across the country, and 46% students not following online classes. Though, like other countries like Sri Lanka, India, Bangladesh, so we are also started this online education system, so distance learning and others approach, but still 46% or more students, we are not able to engage them due to different restrictions. So school closure, till now our schools, I mean not schools, all educational institutes are till closed, and our government is planning to start in a limited scale from the February, after reviewing the cases and everything. Child education, pre-primary, primary, junior secondary, higher secondary, all of those students are sitting at home. They are taking different classes from the television, radio, and others, but very few of them are they are engaging with this online education system. And that I already told that what are our limitations. And then similarly, secondary education is also affected. 2 crore of students that are all actually in the secondary level in Bangladesh, among them male and female ratio, and the dropout ratio also very high. So they are dropping down every day. Before pandemic, students' families below the poverty line, before pandemic, it was about 24%. During pandemic, it was about 45%. And I believe after new normal, this situation will be better. Dropout students getting engaged in earning due to fall in family income, and irregular or zero attendance in schools to increase in post-pandemic period. How about aviation sectors? COVID-19 to cause about 12,000 job loss. Currently, aviation sector supports 129,000 jobs, among them already 12,000 job already lost. GDP loss about 600 crore taka, and at this 0.3% of the GDP, we already lose from the aviation sector. During this COVID-19 situation, we are aware about a new word, infodemic, that was not discussed before, even though we had, but we are not much aware about that infodemic. So here, just few examples. Similarly, I got those slides from the WHO. Similarly, maybe like Bangladesh, in your country also have those infodemics. First, we heard that virus travel through the radio waves, mobile network. But the fact is, mobile network do not spread COVID-19, but mobile device can. I mean, mobile device, if you go outside and then you frequently use mobile device, and then if your mobile surface is contaminated through this coronavirus, and then that can spread. But you are talking with a corona patient from a long distance, it cannot transmit the coronavirus disease. Then exploring to the sun cannot also prevent the COVID-19, but it could boost up your vitamin D level and other immune response, but directly it cannot control the COVID-19, I mean coronavirus. Cold weather and snow cannot kill the new coronavirus. Some of them, many countries, they believe that as coronavirus, we are using disinfectant like alcohol. So maybe drinking alcohol can protect coronavirus. So it's also a misconception. So it was our duty that from myself or from our end, I stopped the spread following the different rules. Till now, we don't have a complete solution to stop the COVID pandemic, but we have solution how we can stop the spread. What took measures by Bangladesh government, as I already explained that complete lockdown was imposed, then constant screening at bank, market, transportation hub, hospitals, sanitization and hygiene points for everyone in everywhere, social awareness program, posters, social media, TV, radio, mobile, and everywhere, healthcare facilities, and government policy and action plans, technologies, COVID diagnostics labs, surveillance, placement of temporary isolation, security. So everywhere, Bangladesh government took very bold and strong initiative to control the spread. And then make a difference during the COVID-19 pandemic, what and how we can stop. All of you, we are all educated person, and till now we are following those things, frequently washing our hands with mild soap or I mean using the different hand wash. We are masking till we are wearing the mask and avoid the crowds, 6 feet distance each other, and PPE and those on the frontliners, and then donating blood and plasmas, follow food safety guidelines, report fraudulent COVID-19 test, vaccine treatment. Bangladesh government also is zero tolerance. They are showing about the fraudulent of COVID-19 test, vaccine, and treatments, and so many frauds are already caught and they are in prison right now. What is the status of the immunization? I already told that we got a good number of vaccine already, and then government is going to start very soon. And I will highlight some slides later on about the Bangladesh also trying to develop their own corona vaccine. So GDP growth rate, in contrast to other countries, selected year 2000 forecast was 8%, where India was 7.2%, Maldives 6.3%, Nepal 6.3%, Bhutan 6%, Sri Lanka 3.5%, Afghanistan 3.4%, Pakistan 2.8%. And we lose basically last fiscal years, we lose 1.1 to 1.2% only. So till now, our GDP growth rate was sound, and Bangladesh government was took really very bold and very proud initiatives that could till now saving the GDPs. So this is our approach, Bank COVID. Now it's changed the name, this Bongo Shield or Bongo COVID. The first DG14G variant, mRNA-based vaccine candidate against SARS-CoV-2, and then Globe Biotech Limited is the owner of this vaccine, and then this vaccination program is now clinical trial phase, and we will get results within very short period of time that how it's working. So this you can see if you are interested. So you can follow. This is public. This by BRICS reprint server, you can check and you can see the status of this paper and the innovation strategies. So, concluding remarks, but here I would like to make it a little bit longer that we really think about. We must learn not just how microorganisms affect climate change. Now we are thinking the effect of this recent pandemic, also the effect of climate change, including production and consumption of greenhouse gas, but also how they will be affected by climate change and other human activities. Where we are, this is a review from the Nature Review Microbiologists, Microorganisms and Climate Change in Marine and Terrestrial Biomass. Climate change in everywhere, agriculture and other human activities, in our livestock, in our waste treatment, in our fertilizer, in our eutrophication, in our extensive farming, in our intensive farming. So microbial biodiversity, we are losing day by day. We are disturbing them. We are using so much chemical and other fertilizer and insecticides, herbicides, and we are producing lots of wastage and we are throwing to our environment and we are losing the biodiversity day by day. And then harmful and different sorts of threat microorganisms, they are changing their habitat, they are changing their lives, they are changing their forms, they are getting much more threats to us. And then climate change exacerbates the impact of the pathogens that I already told. It's not only for coronavirus, for human, they are also affecting other organisms, other crops, others, everywhere they are affecting. So we are getting much more, threat period is coming. Many factors influence the balance of the microbial greenhouse gas capture versus emission, include the biome, the local environment, food web interactions and responses, and particularly anthropogenic climate change and other human activities. We should think and act positively to save our planet, protect the biodiversity, not by hypothetically, but also practically. This is my appeal for myself and also all of you, because we are hypothetically, we are talking so much in the political leaders, all presidents and everywhere. But if we see the activities, but we will be really disappointed. But Microbiologists Society India, I am proud of become a life member of this society. Microbiologists Society India is really doing very hard job, great job of saving the world and activating the microbiologist to act, positively act in this campaign. So what actually happened and where we are moving forward during this COVID pandemic? Access to drinking water in order to able to wash hands and limit the spread of the disease. So we have to find out this new water source, and we are hosting, around the world, how many people are getting the access to the drinking water and the hand washing water properly. We are lucky enough, India, not all over the India, but few states in India, Bangladesh, we are getting much more water. Protect ecosystems to reduce the risk of different zoonoses. Agriculture to provide food to ensure the population's food security. Minerals, part of the essential production chains and hospital supplies. Fuels, limited movement, and reduces use of transportation have reduced carbon emission. This is the most important part. Last 3 to 6 months, we almost stopped our vehicles. All transportations almost was closed, and the people are survived a better way. So it's our time to think how we can reduce the carbon emission, how we can use the transportation use, how we can potentially generate the new technologies. So we have to think about that. Access to electricity is fundamental for quarantining households and hospitals or for all of the people. So in the new normal, we have to focus those water, biodiversity, agriculture, minerals, fuels, and electricity much more. And then we have to be efficient users from our end, government, society, and everywhere. And then the 9 CAP objective that we must follow to overcome those pandemic laws and in the new normal area. Among them, this power in the food chain, climate change action, environmental care, preserve landscapes and biodiversity, support generation renewable energies, or we have to renew our resources. Vibrant rural cares we have to take, protect food and health quality, ensure fair income, and increase the competitiveness so that we will overcome all our situations and our losses. And then that's all for my presentation. I am here, Bangladesh. I am organizing the youth science communication network called Science Portal Bangladesh, and we are actively participating the activities of Microbiologists Society Bangladesh chapter, and I am president of this chapter in Bangladesh. And Science Portal Bangladesh and Microbiologists Society and right now working together against misinformation, disinformation, infodemics, science communication, microbiology, innovations, and all aspects. So we are my labs, cell genetics and plant biotechnology lab, and we are really already Chandrakantha ma'am told that explained that what is my research background is. So we have several donors from Bangladesh government and some private and public institutes. Thank you so much. Thank you for your kind attention. And perhaps I did disappointed you because I'm not much focused on the COVID-19 issues. I talk is different issues. So thank you so much and welcome all of you.
Thank you so much, Professor. Well, though you did not touch much more things about the control of COVID-19 or the coronavirus, but it was really informative and interesting what is to see what is happening in Bangladesh, what are the steps that are being taken by your government and as your the microbiologists, so in the scientists in your country, your contribution and your thoughts and willingness and the concern and everything. So where our people also could be motivated by looking at that. Of course, it's no doubt. It's very interesting and very informative. Much again, Professor Sohil, for accepting my invitation and giving your sharing your time with us, valuable time with us. So all the very best to you and hope to see you very soon